Okay, so I'll talk to you today about the challenges of lymphedema in the obese patient because I see a fair number of patients who have primary lymphedema, meaning that they were born with a lymphedema system or lymphatic system that does not work very well. And then you have patients who have secondary lymphedema in which the system is damaged in some way. Okay? And out of the secondary lymphedema, I see a fair number of patients who've had surgery for cancer, particularly breast cancer. But more than anything, I have patients who have obesity and they're significantly overweight. So the question they ask me when I tell them that they have lymphedema is, okay, so what do I do now? And I'm going to try to answer that question today, but also give you a little background on lymphedema and help how the system works and why it works and why I tell my patients what I do. So I don't have any disclosures or contracts with anyone. And I'm hoping at the end of this that you would understand how lymphedema is affected by being overweight. And I have patients who tell me they're from Louisiana and food is just too good. So that's one of my challenges. If you wonder what the first challenge is getting, I'm not is getting them to understand that yes, what they eat affects how big they're going to be. And that's a challenge for all of us, including me. I love cashew nuts. But it really can affect lymphedema itself and how it's treated. The garments you get, how can the garments you can afford. So all these are challenges. And I hope you will be able to recognize signs and symptoms of lymphedema as, sometimes a lot of patients, they don't recognize that they've had it, or they think at the time they see it is when it began. But usually there's early signs. And, there's certain risks I want you to remember and be aware of. So, one of the questions always is it lymphedema? Is it what we call venous insufficiency, meaning the valves in the veins don't work? Well, it can be both. And the answer sometimes is yes, it could be both. So sometimes people will have swelling in their legs and you push the thumb down and it stings. And that's usually when you see swelling related to problems with the veins. The valve in the veins don't work as well, or they have varicose veins. And sometimes this happens as some people get older. With lymphedema, in the later stages, even when you press down on the swelling, you can't leave a thumbprint. So that's one of the ways to go. But like I said, it can be both because the problems with the vein can affect the lymph, and the problems with the lymph can affect the blood. What is lymphedema? So we know it's where the lymphatic system doesn't work very well. Sometimes people are born with it, so we see babies that are born with it, the system just never developed well. And sometimes it's damaged, as I mentioned before. What you get is the deposition or accumulation of a lot of protein-rich material. So the protein from the blood vessels sort of deposits just under the skin. And that helps to bring about some of the changes for lymphedema. And I tell people it could be either primary or secondary, and we know that obesity is a secondary cause of lymphedema. But the challenge is, with lymphedema itself, because of how it works, and you get inflammation under the skin, that inflammation makes the fat cells deposit more. And it also makes what we call connective tissue or fibers, it gets scarring, deposit in the skin. So you have somebody who's already obese, and then they have lymphedema, and you have more deposit of fatty material. So the lymph just keeps getting bigger and bigger. there is no cure for lymphedema. I have to tell my patients this all the time. There's no pill I can give you. Yeah, and the answer to that is usually why. We don't have anything yet. But it can be well managed. And if we identify it early, which is the important thing, then we can treat it well. And lymphedema patients can work. I have patients who start crying when I tell them they have lymphedema because they say, well, now I have to go on with disability. That's not true. They can work, if we treat it well and they maintain their garments, and that's another challenge, the wearing of the garments, then they can work. So I have patients in all these different areas in terms of coverage. Okay, and that's only some. The lymph system is all over the body, and the lymph system consists of lymph nodes. Like when you have a sore throat and you feel your lymph nodes swollen, it's because it's part of the immune system. Then you have lymph vessels, and you have, the tonsils, the spleen, all of that is part of the lymph system. We don't always think about it. And the role is, in the immune system, the lymph system carries all, or most of the proteins that fight infections, the cells that fight infection. And, the lymph nodes act like little factories along the way, and they pump all these cells when you have an infection and send it to the right site to fight the infection. When you have lymphedema and that system doesn't work well, then you're at risk for getting infection. So we'll talk a little bit later about what I tell my patients to minimize that risk, because otherwise you get skin infection and it spreads really quickly. The lymph system also transports fats. So, when you have a good piece of cheesecake, the lymph system is involved. You're revving up your lymph system. And it also, there are certain vitamins that need fat to be transported in the body. And there'll be vitamins A and D and E, K. So it's important to have the lymph system working. And in terms of fluid, it helps clear excess fluid from the cells, and the veins and the arteries and the lymph system, they interplay. So the red would be where blood comes from the heart. Then you'll see those little circles, that's where the cells are. So the fluid bathes the cell, and when it's finished and they want to pick up all the trash and they don't need it anymore, the veins will pick up most of it, but the lymph will pick up the protein and the fat. Okay, so you have those three systems always playing together, and one affects the other. So mostly the lymph fluid has water, it has the protein, it has the cells, the infection fighters, the fats, blood cells, especially the white blood cell, which fight infection. And you have substances that kickstart cell reactions, the reactions to break down the food that you eat. So that cheesecake that has to be broken down, that's in the lymph system. You have what we call enzymes to do that. So this is one of the reasons why if you take diuretics for lymphedema, it doesn't work, because all you're doing is getting rid of the water, and then you're making that protein thicker. So a lot of times patients come to me and they say, oh, I've been on diuretics and it doesn't work. And I think, of course. But there's that idea that, if you get rid of the water, will help the lymphedema. It doesn't work well that way. It will help with the veins, but not with lymphedema. So what are some of the symptoms of lymphedema? Patients have different symptoms. Some people say, my arm feels full, or it's kind of aching, or they may have joint pain in the joint closest to the limb that's affected. Some patients, one leg is bigger than the other, and they have to wear two different sizes of shoes. That's a challenge, because sometimes, who could afford to buy two pairs of the same shoe? If you like shoes. You might want to buy different shoes, right? So you have that. You have the chronic swelling, and if the lymphedema is not treated and it gets to be advanced, you get thick, dry skin that looks like elephant skin. So sometimes lymphedema is referred to as elephantitis. The skin gets dark in certain areas. You get little fleshy bumps along the way, and then you get big areas of just fat, and which actually pictures of that like lobules, and you get sweating. And sometimes the lymphedema just leaks out of the skin when it's not controlled. And people I have patients who walk and squish, or they leave a wet footprint everywhere they go. And that's when it's really not well controlled. So what are the general risk factors? You have risk factors meaning the things that could cause lymphedema, especially secondary lymphedema. Like I mentioned, surgery for breast cancer, of course obesity, if you've had blood clots, and the vein is damaged because of the blood clots, then you have problems in the veins, which leads to problems causing lymphedema. If a patient is paralyzed, they don't have that muscle to pump, the muscles can pump the fluid along, whether it's venous fluid in the vein or whether it's the lymph fluid. It has to pump it along. So people who don't walk, and this is why the therapist will say, wear your garments and walk, because you need that muscle pump in the calf as well as in the foot. Cancer, of course, if you have cancer and the lymph nodes are damaged, then you don't have that flow. Radiation therapy will also damage the lymph nodes. And outside of the US, there's a tropical worm that can is living in the lymph nodes and destroy the lymph nodes and the lymph vessels. So that would be the #1 cause in the world. Okay, so advanced lymphedema, I talked about you can get scarring in the skin, so the skin looks really thick. You get, of course, increased deposition of the fat, so you have more fatty tissue there, the weeping, and the chronic swelling. And I'll show you pictures of that in a minute. So the obesity will cause the lymph system not to function well, as I explained. And you have all of these fatty deposits pressing you down. And especially when someone has a lot of abdominal fat, it presses down on the fluid as it's trying to come back from the legs to the heart. So it's like blocking that flow of fluid. So if you think about like on a highway, there's an accident, downstream you have a lot of cars parked, nobody can move, that's sort of what happens. So some of the negative impact is the thickness of the skin. The cell linings don't repair like they should, and the vessel linings don't repair as they should. So then the flow is not as smooth as it should be. As well as the pumping action, each of the vessels pump, and they don't have that pumping action to move the flow. So basically, what you're always talking about is lymph fluid not flowing well. So whatever the cause is. So what happens with obesity? With obesity, you're limited in being able to take nice, deep, full breaths or breathe from the diaphragm as we say. And we know when we do that, you breathe from the diaphragm and you have pumped that fluid forward as it should be. But when you're obese, it's difficult to take those deep breaths. We know that lymphedema after mastectomy is about 3 times higher if the patient is obese at the time of the surgery. Right? We know that, for instance, if a patient is normal weight, which we call BMI less than about 25, or between 20 to 25, and 3 lymph nodes are removed, that patient would have a less likely chance of having lymphedema than someone whose BMI is about 45, even if it's only 3 lymph nodes removed. Because as we go higher up in BMI, meaning higher up in your weight, that risk increases. When you get to BMI of 60, and I can't tell you what number in pounds that is because BMI is calculated based on the height. So let's say you have somebody who is 6'2" and 200 pounds. They're not going to have this. They'll have a lower BMI than somebody who is 5'2" and 200 pounds. So the person who's 5'2" will be a lot bigger. And that, when you get to BMI of 60, you almost always have lymphedema. And being obese, you limit the exercise that you use because with obesity, when you're overweight or obese, you put a lot more pressure on the joints, especially the knee joints and the hip joints. So then people just can't walk as fast. It's painful to walk. And we always encourage them, take a walk. I tell my patients, even if it's half a block. But I'm sensitive to the fact that if it's hurting, they're not going to want to walk even half a block. And of course, obesity can cause lymphedema itself. So now we'll talk about the risk of infection. One of the types of infection we get is really a deep infection that you'll hear about patients talk about, and your therapist will talk to you about is the cellulitis. And it comes easily because staph and strep live on our skin, and if the slightest breakage in the skin could cause an infection. And cellulitis in a lymphedema patient, because the immune system isn't working well, can spread very, very quickly. So for lymphedema patients, if they have any, I tell them if it gets red or warm, find a doctor immediately. Don't try to stay home and put Neosporin. It's a favorite thing. Yep. Do not try to stay home and put Neosporin because it will spread very, very quickly. You can also get infections of the lymph vessels. And the lymph vessels, and it looks like little streaks, red streaks that go up and down the arm or the leg or wherever it is. First sign of that, find a doctor. Okay, whether it's urgent care, emergency room, or you call your physician and say, hey, I have an infection, I have lymphedema. They know what that means. So because of that, I would tell my patients things to avoid certain things or minimize certain things that would make lymphedema worse. Hot tubs. So anything, heat brings more fluid, okay? So already the lymph system is at its capacity. And then when you add anything heat and that brings more swelling, then you overcapacity and it makes it worse. So I know people tired of hearing don't. So I don't tell them don't. I say, if you're going to be in a hot tub, limit the time, decide if it's going to be half an hour, if it's going to be an hour, come out, do your gradual massage, and put your garment on, right? If within 2 days you notice that the garment is tight, then go back, call your therapist, see the therapist, and make sure that you can function well and you get rid of that tissue. But no diabetes, okay? No diabetes. Manicure, pedicure. Okay, I have my fashionistas who want to make sure they're looking good. Avoid cuticle trim because if you nick the cuticle and it starts to bleed, then you have a place for infection to take place. So you could tell them that they buff it, do whatever, put your nail polish on, you're good, but try not to have the cuticles with the manicure and the pedicure done. Pets. Okay, all those people who love their pets, I'm good with it, but avoid the claws. So if you can declaw them or make sure that you're not getting captured, particularly with cats, because you could get cat scratch fever, but you can get scratched with any pet. Some people have these warmers. I don't understand it, but hey, no judgment. And so any of those things, and you know, and on the clothes of all these animals carry bacteria, so you want to be careful of that. Gardening, people love their rose bushes, and so I said, wear your gloves. Make sure, I've seen some agreement. Make sure that you protect yourself and try to avoid the thorns, you know, as much as possible. This happened to a patient of mine. She had a vasectomy and she was lymphedema was well controlled. And she was in the hospital and she told the nurse, don't take my blood pressure and arm. And the nurse said, oh, it's been 10 years, you're fine. So she took the blood pressure. And then of course, she increased in size and had to come see me. She was not happy. And somehow there's an error in thinking that after 10 years that the lymph will flow in different areas. It does, it's true. It's kind of like when you're on the highway and there's an accident, you get off on the feeder. So the fluid will find its way. But on the highway, that accident is cleared and then flow can go. But with lymphedema, that's a permanent blockage, right? Or a permanent dysfunction. So, you know, telling somebody it's been 10 years and then it's not your arm and then you take, they have to live with it. So, be insistent about this. I understand my disease, please. People with ingrown toenails, that can become infected easily. So, you know, that's the time to see a podiatrist. By the time the pain stops, don't wait for the pus. You know. Moist feet can cause fungal infections. Fungal infections in the feet can very easily lead to cellulitis. So always be careful of that. Dry the feet between the toes well. And if you have to, you can always use an anti-fungal spray. Alright, so the patient I talked to you about with the blood pressure, she was a stage 0. She had abnormal flow from the surgery, but her exam was normal. Her arm looked normal. So that's why the nurse thought, well, okay, you're fine. But she wasn't fine because she had abnormal flow. And that would be a stage 0. Now, when you have a little bit of pitching, but you could raise your arm or raise your leg and it goes down, that's just stage 1. And then you go to stage 2, where you're having the pitching, but you know, raising the arm isn't too much. Okay? And then you get to stage 3, where you have scarring and fatty deposits and all the skin changes, the skin darkening, and that's the advanced stage. I mean, you don't get more than that. So, I want to caution you that I'm going to show you some lymphedema pictures. Okay? Kind of rough. So, here was a patient who was actually near and dear to my heart. He was on his mother's insurance, and at that time, before the marketplace insurance, or what people call Obamacare, you had to get off your mother parents' insurance at age 18. Well, he did, and by the time he came back, he was out of control. Now he's been followed up very well, and he's well managed. Okay, so these little bumps you see on the leg, those in our case of advanced lymphedema, those are the papillomas that I talk about. Those are fleshy, and some of them sometimes have lymph fluid in there. Most times they're fleshy, and this is the advanced stage. Here you will see more skin changes. So it's fibrous. It's looking really a lot of scarring going on. The white areas is where the lymph fluid was leaking out, and it's just there. And you can see those little cracks. And we'll talk about those cracks. And then you see patients who have the skin grows over and over and it gets thick. When we start treating them, sometimes we can just rub it and clean it and it falls off. So that's what you see Good. I hope nobody's stomach is turning. And you have scarring, and these are not really toes. These are what we call fibromas on the toes. Okay? And here is my lymphedema patient who really started off with a problem in the veins. And every time I talk to him, I would say, what did you eat? Because you need to manage the amount of salt fluid. And he told me, I'm from Louisiana. So he would have bone and anything and everything he wanted, you know? And as much as we tried working with a dietitian and everything, it just didn't work for him. He just, he was one of the ones. If you see all the wet behind it there, that's lymph fluid that was leaking out. And lymph fluid is a great place for bacteria to grow. So the odor, before I got to you, I would know that, okay, this patient is here because, you get that odor ahead of time. So these are the challenges we have with patients who are obese or who think, that their lymphedema is hopeless. There's part of that too. They feel kind of hopeless, and I will really encourage them that they could be well managed and it doesn't have to stay like this. These are the lobules that I was explaining, those big areas. That's a challenge too for the fitters and the vendors to fit and maintain. And if you would lift up, and I have to lift up each of those lungs and look under the skin because there's usually cracks. And if there are cracks there, and the patient may not feel it, then that's a place for bacteria to get in. That's a place for them to get that skin infection called cellulitis. It's very easy to happen. And as I say, when the BMI is greater than 40, it's almost absolute when you get to 60. And this is the skin darkening, and I want you to have someone with a lighter tone skin. You see it starts off red and then it gets brown. And sometimes people ask me if it's sunspots. No, it's not sunspots. It's the red blood cells breaking and leaving the pigment in the skin. Again, you see lobules. Sometimes the lobules don't happen on both sides. It could be just one leg or one place. Shoe size difference. And this was my 25-year-old, and you can see the skin is thick and hard, and it weeps, so you have that white area. And then again, sometimes thick patients come like that from the beating. So how not to treat? We talked about diuretics, not being the adult. And sometimes people say, well, why do I have to go to a lymphedema therapist? Can I go to a general therapist? If that therapist is trained with lymphedema, that's okay, but general therapists do deep massage, and about 70% of the lymphatics is in the skin. It's in the upper area of the skin. So the lymphedema therapists are trained to know exactly how to massage at that upper level. It's more of a gentle massage. ACE bandages stretch as the swelling stretch, so that's why the lymphedema therapist will use something we call short stretch. The bandage doesn't stretch very much because it then compresses that fluid back into the system. And if you use a pump, and pumps are great, but they're not standalone. You don't just use a pump. Sometimes patients come and they tell me, well, my PCP prescribed me a pump, but it isn't working, so it becomes an expensive piece of equipment in a closet. You have to have the full massage, the bandaging, and all of it, and then add the pump therapy on top of it, and then you're good. You're really good. So, how to help? You want to do diaphragmatic breathing, daily skincare. I ask people all the time to make sure that they look at their skin and look for the changes. Look for cellulitis, look for pitting, look for weeping. Moderate exercise always, and you will see a lymphedema specialist or go to a lymphedema clinic. So what is the manual lymph drainage? It's a specialized massage that takes the flow from areas that are compromised and teach the lymph to flow to areas where it could drain well. It moves the protein by the pressure that is applied, the gentle pressure, and it's performed by certified therapists. That too is not a standalone therapy. You can't massage yourself every day and think the lymphedema is going to be controlled. It just doesn't work that way. And it's safe for patients with active cancer who are undergoing treatment. We didn't always know that, but the studies over the years have shown it's okay. Because we know that cancer cells spread some cancer cells spread via the lymph. So there was a concern if you move in the lymph and you know cancer cells spread with lymph, then it's possible to spread the cancer. But that has been proven to be true. So I take very careful care of treating patients who have congestive heart failure or anything where they cannot get rid of the fluid. So if they have kidney problems, anything, congestive heart failure causes you to have swelling in the legs already. And then if you have lymphedema, so it can cause lymphedema. And if you have lymphedema on top of that, then it makes it difficult, but you have to be able to go to the bathroom. So lymphedema patients will tell you once they get wrapped, they find they go to the bathroom more often because they're getting rid of that water component in the lymph fluid. So we have complete decongestive therapy, which will involve the manual lymph drainage as well as the bandaging. And of course, we can do the pump therapy on top of that. So this is, you'll be familiar with these, this is the short stretch bandaging. These are patients that have been bandaged. Sometimes we use physio tape, kineso tape to help move the fluid along. The lymph therapy, if you notice this patient had a skin flap and it's full of lymph fluid, they massage and it's now much flatter. So this is one lymphedema patient who had lymphedema of the tongue and had the massage of the tongue for about 8 minutes and was able to close his mouth. This is the patient pre and post treatment, and these are some of the garments that we use with patients we're familiar with. Of course, my fashionistas like the ones that look like tattoos. They have aids, dummy aids to help put things on and off because it can be difficult. I like the Velcro garments for my elderly patients because it's easier to go on. And of course, we use the pneumatic pumps, and they all have different manufacturers, and we refer to more than one manufacturer. So, any questions?
Are there any surgeons in the UT Health or Memorial Urban System now that are doing LDAs and lymph transfers for treatment?
No, not currently. There were two at NBM and they moved out of town. I still refer to one who's in Dallas, but I'm trying actually to connect with some people and see, because it's a need. So for some of the lymphedema patients, surgery is an option. They are selected very carefully, and several different techniques are used, lymph transfers, and joining the lymph to the veins, several different techniques. So, but those patients are screened by the surgeons very well. Anybody else? Yes?
My question is in regards to the cellulitis of the, okay, so a mosquito bite. One mosquito bite, the lower portion, but the whole arm.
Yes.
Swelled up.
Yes.
I mean,
And very quickly.
None of mosquito bite, but then I had to elevate, but it relative like if I had just pooped.
Yes.
It was horrible.
Yes, because remember with lymphedema, the immune system doesn't work as well. So in another person, that may be fine.
My husband got 8 of my mosquitoes.
Right.
No problem.
No problem.
I had 27 of my lymph nodes
Yes.
were totally removed from this right side.
So you have 27 times reason why your immune system is not going to work well in that arm. So in that case, always find a doctor to give you antibiotics right away because it spreads very quickly, and we know for a fact, depending on the patient, if they have diabetes or some other reason why they also have another immune system, another reason why the immune system, they could end up in the hospital in ICU. So I don't play with that. I always say, it's better to go to the doctor and find out, oh, it's not a problem. I tell my patient, I'd rather you come and I say, oh, you're fine. Then you stay at home for 3 days and then they call me saying you're in ICU. Okay, well, thank you all very much.